You are connecting to CampusLink. My name is Rodrigo.
And my name is Lupo. We showcase the best of Vrije Universiteit Amsterdam.
We are VUCampus Radio,
Connecting the campus. Today we are discussing psychedelics. My guests are Kenan De Lau and Annika Wirsching. They are the board members of APRA, Amsterdam Psychedelic Research Association, which is an organization that revolves around educating people on psychedelics and conducting research, although right now they don't have any research going on. Kenan is a neuropsychologist at Vesalius Neuropsychiatry, where he treats patients with brain injury and psychiatric disorders. He is also the chair of APRA and he has a broad interest in psychedelic medicine, especially in their clinical applications. Annika is a psychologist and junior researcher at RQ Centrum, where she treats patients with PTSD. She is also involved in clinical trials on MDMA-assisted therapy. Furthermore, he is the vice chair of APRA. I hope you enjoyed this discussion as much as I enjoyed talking to them. Let's begin the podcast. Welcome everyone. Today I'm discussing with APRA, the Amsterdam Psychedelic Research Association, and they are mainly focusing on educating people about the psychedelic sciences. But I'm going to let Kenan explain that more briefly. So how would you introduce APRA to the audience?
Yeah, and thank you for having us, by the way.
Thank you for coming.
Yeah, of course. So as you said, APRA is the Amsterdam Psychedelic Research Association. We are a non-profit academic association based here in Amsterdam with a focus on psychedelic research. And really, I should say, altered states of consciousness research in general. So we organize lectures, symposia, and journal clubs about developments in the field of psychedelic science. And we try to take an interdisciplinary approach doing this, meaning not just the usual suspects such as neuroscience, clinical psychology, and psychiatry, and life sciences, but also the humanities such as philosophy, anthropology, and even political science. So we try to take a broad approach in that. And we have a lot of student members, but researchers as well, and we form a network where people with similar interests can connect with each other and discuss their favorite topic, which is psychedelic science.
Sounds awesome. Can you elaborate a little bit on this journal club that you guys have going on? What does that entail? Do you find a book or some form of research that you guys go over together, or how does that work?
The difference between a lecture and a journal club is that lectures tend to discuss broader topics in science, and journal clubs are these specific papers where the author of a paper is invited and can talk about the research that they've done, and APRA members can ask specific questions about their methodology, how they came to their conclusions, and you can really have more of an in-depth discussion with the author themselves and get the information straight from the source. So that's a pretty unique event that we offer.
Sounds awesome. And what do you guys do specifically, you two, in APRA? What are your day-to-day things?
Maybe Annika, you can introduce yourself.
Yeah, so Kenan and I, together with Paloma, who isn't here, are the board of APRA. So we're currently mainly organizing the organization. We have a team of, I think, more or less 15 volunteers at the moment who's running the organization, planning all the journal clubs that Kenan was talking about, all the lectures, all the events. We're managing the social media posts, everything around that. And Kenan and I, together with Paloma, are the board of that. Really happy about that. Happy to have a big team of volunteers that are super enthusiastic about the topic and about setting up the organization and everything around it.
That sounds awesome. So you guys do have like a big volunteer, like 15 people. That's quite a lot.
Yeah, and that's mostly the active team, but we have about 150 members, some of which just enjoy the events and they come and hang out, or they just read the newsletter every once in a while. But I think we are growing quite a bit in recent years, especially the past year. We have gained quite a bit of attention and a lot of new members. So we're trying to work on the structures of having everyone become a bit more active and join our departments. So we're growing every year.
You can really tell that the interest on the topic is really growing. APRA actually started in 2018 with a very small group of people that were interested in the field. And then it grew to something not huge, but it's quite big for just one topic, basically.
What do you think is the reasoning behind that? The growth and the interest, growing interest of psychedelics?
Yeah, I think, first of all, of course, the recent years there has been more research on the topic, but also mainly a lot of media attention on the topic. So if you've been a bit aware, then there's stuff on Netflix, there are books about the topic, there's every other day, there's a news article. Of course, I live a bit in a bubble because I'm really into the topic, but I think a lot of people are realizing that there's a lot of research going on.
Definitely.
And
I
that,
think Michael Pollan also introduced a lot of people to the
yeah,
subject.
yeah,
With his
Michael
book and
Pollan.
the Netflix documentary, yeah.
Mhm.
Yeah, that was a big push for the field to become more into mainstream awareness. Yeah, and
Yeah.
that helps APRA with getting more members,
Yeah.
of course. So it helps growing.
Yeah, and even if you're not really necessarily working in this field, or even if you're not in academia, the past few years there has been so many attention in the media. Like even my grandmother recently came up to me and said, "Have you heard about this thing that's going on in psychiatry with psychedelics?" And I was like, yes, I have heard about that.
No surprise there.
Yeah. So I think a lot of people are at least superficially aware of some of these developments going on.
Yeah, like the surface level information is out
Yeah.
there for everyone.
Yeah, that it's a new frontier and there's a lot of excitement, but also a lot of questions that remain, of course.
Definitely. I hope to discuss those questions with you guys today. And what do these lectures look like with you guys? And what are some of the topics, for example, in the latest lectures and maybe some upcoming lectures that you will have?
Yeah, maybe a really nice example of a lecture that we had, I think 2 weeks ago. So not that long ago, was at the UvA on just psychedelics. And actually we had a really large show up. So I think 700 people
Wow,
came to
that's
that lecture.
insane.
Yeah, we had a lecture hall, which was completely filled, and then a screening hall next to it, and then even people on Zoom joining. It was mainly students because it was at the university. And one of the first questions was who actually learns about psychedelics during their studies. And then people raised their hands, but not a lot of people raised their hands. And then the second question was who would like to learn more about psychedelics in their studies. And then I think, I don't know, I
Everybody.
didn't count, but I think
Yes.
almost everybody raised their hand.
Yeah, it's
So
an
that-
interesting topic for sure.
Yeah, that was a perfect example of how super many students are really interested in the topic, but aren't really learning in academia about it.
Okay,
And that's where we
you come in. Yeah,
Yes.
exactly.
That's
Yeah.
where we come in with the goal to actually fill that gap and focus on the scientific side of it, but educate people about it.
What are some of the... Oh, go ahead if you wanted to.
To your question, so that was a general lecture on psychedelic science throughout history and some of the more general things going on. But we're also organizing a lecture about psychedelics in relation to Buddhist philosophy, for example, in about 2 weeks. I'm not sure when this podcast will go live. Perhaps when you're listening to this,
Something like that,
it's
yeah.
already been.
I can make sure that it goes out before. We just have to...
We'll see, but it's just an example of the kind of interdisciplinary approach that we take. So it can be neuroscience and psychiatry oriented or life sciences, but it can also be more philosophy oriented. But indeed, like Annika was saying, that recent lecture at the University of Amsterdam was really a wake-up call for us. Wow, we knew that this topic was getting some attention and students were really eager to learn about it, but that turnout was really crazy, like 700
sounds
people
really crazy,
who were
yeah.
just very eager about the topic. And it also inspired us to think we should, like beyond just providing lectures, we should perhaps think about how we integrate this education into the university system itself. But maybe we can talk a bit more about that.
Go ahead,
later
go
on.
ahead. I'm curious how, if you want to elaborate on that, like how would you, for
Yeah.
example, put it into the, for example, the psychology education? I
Mhm.
think that's really relevant. Also, if somebody studies to be a neuroscientist, that's also really relevant.
Yeah.
There's so many research on like neurogenesis and that type of thing. It could be interesting to have your perspective on that. How would you
Yeah.
incorporate psychedelics into education?
Yeah, it's a good question. Right now, we're still in the planning and idea stage because when you undertake something like this, you want to do it right. But I do have maybe a good example of how limited the current education about psychedelics is in academia. I actually studied here at the VU and did my psychology bachelor. And I think it was about 5 years ago that I had a course on psychopharmacology. And that would be a super relevant course, right, to discuss psychedelics.
Exactly.
And not just drugs for medicine or addiction. And there were about 2 slides dedicated to psychedelics, which showed like a kaleidoscope and Jimi Hendrix and like some mushrooms. And it was like people in the 60s tried LSD and it was crazy, but it's a thing of the past. And I was honestly in shock. Like I was like, because 5 years ago, there was still a lot of research going on. There was already plenty of attention to this topic. So I was a bit shocked, honestly, that like within this university that offers high level education, that they were lagging behind.
I'm actually also studying psychology, and I was really excited about that course because I have it coming up. But then
Let us know
I
if
don't
it
know.
changed, maybe.
Okay,
Yeah.
I will let you guys know.
And otherwise, invite us.
Exactly.
To have a
Maybe
lecture.
in 5
something.
years' time, maybe it will have improved a little bit, but universities tend to be also a bit conservative about
Very
stuff
much
like
so,
this,
yeah.
and it's still very much in early stages, but I think it definitely deserves more attention at this point. So one way you could go about that is by, at the University of Amsterdam, for example, they have this design a course challenge where you can submit a course set up and say, these are the topics that are going to be discussed. These are going to be the teachers, and this is why it's relevant. And I think students can actually vote on which course they like the most, but that would be more of an incidental thing. But I think it would also be great to just go and discuss with the faculty and with the professors themselves. Hey guys, this is going on right now in academia, and you might not be as aware of it right now, but you should definitely try to orient yourself a bit more about stuff that's going on, because
Exactly.
it's going to be relevant.
Yeah, totally. I
Mm.
can see that there's so many research that we could potentially discuss in this area. And I think that, for example, some of the research like showcasing that, okay, these things might revolutionize how we look at mental health, how we look at addictions and all those kinds of things.
Yeah.
So
There are actually good examples or positive examples of courses in academia as well, though, which I'd
Yes.
like to mention.
Of course.
go
Of
ahead.
course.
Because,
Go ahead.
sorry?
Go ahead, mention them.
Yeah, sure. No, because actually I studied in Maastricht. I did a psychology bachelor as well in Maastricht. And already, I think it was in 2015 when I started in 2014, but 2015 I had a course there which was called Drugs and the Brain, I think. And it was all about drugs and how they influence our brain, how they affect our brain, about mental health. And which is actually also how I gained interest into this topic, actually through that course. So there are good examples, but I think other universities should follow with integrating courses like that into their curricula.
Definitely. What are some of the things that you would discuss on a course like this? If you would have a complete freedom in designing your course, how would it look like? 6 weeks to teach people.
Good question. I think it depends on the area of study, but in a psychology bachelor's, for example, there is actually an honors course right here at the VU. You might be aware of it. It's called Drugs That Alter Your Mind,
Yes.
which is a course that was actually given by Jos-Jan Zijlmans, who also presented the lecture at the University of Amsterdam 2 weeks ago. And I think it covers the history of psychedelic science, because a lot of people are not aware that many of these drugs were already researched during the 1950s and 60s.
Yeah, exactly.
It covers clinical applications for some disorders you already mentioned: addiction, depression, anxiety, PTSD, some of the applications for neuroscience and consciousness research, and really just the kind of fundamental questions. How do these substances even work? Because there's a lot of theories about that, but not a lot of agreement on how these substances actually enact their effects. So I think it would be a very broad course, but of course in neuroscience or psychopharmacology, you could have more specific oriented courses that are a lot more fundamental in nature. I don't know, Annika, if you have any other ideas?
I think the nice thing with psychedelic research is that it's so multidisciplinary. So it can be what Kenan is saying. It can be about history. It can be about anthropology. It can be about clinical applications, neuro. So it can be about a lot of things. So I think 6 week one course is not enough to really
Definitely.
go into it in depth. You can
Just
you can do like an introduction level course, or of course, if it's more specific about if it within the anthropology studies, of course, you can go into that topic. But yeah, that's the nice thing, that is really diverse and you can go into a lot of directions. And I think that would be the best thing as well for a introduction level course.
Yep.
There's also a lot of online education going on, like, for example, MAPS or Aleph Trust. I don't know if you know them. They are a different foundation. And they are also offering like MDMA assisted therapist, basically like this training. It's a 1-year course that gets you basically certified to put people through a trip, although of course it's not legal yet, and there's a lot of it is legal in certain places, right, to research. I don't exactly know maybe you can elaborate, because I know that you are in some field like this currently doing research. I know you can't discuss your current research, but maybe you can elaborate on the current state of how MDMA is in terms of political legalness, and what are some of the current research around that topic.
Yeah, sure. So MDMA is mainly being used for in research, being used for the treatment of post-traumatic stress disorder. And regarding its legal status, it's not legal. That's how it is. But in research, it is allowed to use if you go through a lot of like ethical applications. So you have to go through a whole process to actually be allowed to use it in clinical trials. But if you go through that and you get through it, then you're allowed to use it within clinical trials.
Can you share some specific results or specific research papers in terms of how successful MDMA is in treating PTSD?
Yeah, so the main organization that's driving this research is MAPS, the Multidisciplinary Association of Psychedelics, difficult name. And they're conducting phase 2 and phase 3 trials. So if you want to get a new drug registered for a treatment, then you have to go through different phases. And they've finished their second phase 3 trial not long ago, actually. And the results look very good in
Yeah, I saw
general.
it in
Very
the
large.
2023 newsletter. They shared
Oh, yeah.
it.
Okay.
But
So,
go ahead, go
so
ahead.
you know it better. No, yeah. So it's very recent that they finished their second phase 3 trial. And that is necessary to continue the process of registration in the US to get it actually registered as an legal treatment.
That's really interesting.
So the results are looking good at the moment.
Do you know some specific results of like how, like in percentages and success?
They differ, and also maybe it's good to mention, by the way, that Annika is a psychologist and also a researcher at the ARC, National Psychotrauma Center, which is taking the lead in the Netherlands concerning this MDMA for PTSD research.
Yeah.
And I think another good thing to mention is that it's mostly patients with treatment-resistant PTSD that are being treated with MDMA-assisted psychotherapy. That's correct, Annika.
Yeah.
So these are patients who have already tried multiple forms of medication, so pharmacotherapy, psychotherapy, and have still not been adequately relieved of their symptoms and are all severely debilitated because of this disease. And I think in the 2019 or 2020 results, or maybe even 2021 of MAPS that was published in Nature, I think they had a rate of about 67% of these patients with treatment-resistant PTSD who no longer met the criteria for PTSD. So
It's crazy. So 2 in 3, basically.
Yes, and
That's a lot.
we generally don't use the term cured because it's not really, it's a bit more nuanced than that, but they do not meet the DSM-5 requirements anymore for the diagnosis of PTSD. And that's pretty astonishing. You don't really see those results in psychiatry with any other intervention.
Yeah, that is insane.
And 2 things I would like to add to that. It is indeed called treatment-resistant PTSD, but actually there's no such thing as treatment-resistant. So it doesn't mean that people really had all treatments that there are, but that they meet specific criteria for which we then call treatment-resistant, but it's not an official diagnosis to be treatment-resistant, have treatment-resistant PTSD.
Okay, thanks for clarifying, because that's what I thought, that they were like 3 years in and they tried everything and...
That is often the case. It's just not that they really tried everything. There are still maybe options, but then they need to meet specific criteria to be part in the trial.
Oh, I see.
And they don't have to have tried everything. But usually people are in a long or journey already before they are allowed to participate in trials like that.
I see. Yeah. And can you elaborate? Oh, sorry, go ahead.
Sorry, yeah, that was just one second point that I would like to add, which is that these results are very impressive and very astonishing, but it needs to be mentioned also that there are under ideal circumstances. So oftentimes when we see clinical research then afterwards going into the real world, we see that it changes a bit and results might change a bit because now participants are really in this phase in which there's a lot of enthusiasm about the topic and people are really believing in it. And we don't know whether that really adds to the effects, but it is something to be aware of that I
think it will potentially maybe add to it as well, as the placebo can also work a little bit.
Yeah, for sure.
Can you elaborate on how does a session of MDMA therapy looks like? And for example, if I was a PTSD with a patient with therapy resistant, is it one session or is it multiple sessions? How does a single session look like? Is there a preparation that leads up to the session?
Yeah.
What are the things that go into a MDMA therapy?
Yeah, that's a very good question, because a lot of times people really think, okay, we just give them MDMA and then they're better. And that's for sure not the case. I'm glad that you're asking this, because the MDMA sessions are embedded within a 2 or 3 month, it depends a bit on the study, but a long psychotherapy, how do you say?
Therapy sessions?
Yeah, like into psychotherapy basically. And people usually have a couple of preparatory sessions. So where it starts with a very thorough and long screening period. So people go through a lot of screenings to see whether they're eligible, both health-wise, but also with their private situation. There's a lot of components to it. And then people enter the preparatory phase where they meet with their therapist. They usually have 2 therapists every week or a few hours or 1.5 hours, for example, where they get prepared for the MDMA session. So you talk about what you can expect from the effects, the subjective effects of MDMA, what you want to work on, what you have to pay attention to. So you really get prepared well for it. And then after that preparatory phase, you have your first MDMA session, which usually takes a whole day. Usually patients come to the clinic in the morning, get some testing, some preparation, and then they get the MDMA. And then it usually takes 6 to 8 hours for the effects to last. And then after that, which is also a very important part of the therapy, is the integration phase. So everything that you experience during the MDMA session, you have to integrate into your daily life, but also make sense of it. And you do that together with your therapist as well. And then usually have 3 sessions of that, and then another MDMA session, again, 3 integration sessions, and then possibly a third MDMA session, and then again integration, and then the trajectory.
So it is
and
like a long period of.
Yes,
Yeah.
it's a very long and very intense period because you have weekly contacts with 2 therapists, which is quite intense. So that probably adds a big part of as well to the effects that we see, just the intensity of that period.
Yeah, that's for sure.
Yeah.
You gonna share? Yeah.
Yeah, I think it's a very important point that Annika is making, that to our best understanding right now, these substances such as MDMA, but also psilocybin, which is the active component in magic truffles and mushrooms, DMT, and perhaps also LSD, that they are so effective because they are embedded in a psychotherapeutic framework, and they work as catalysts for a psychotherapeutic process. So there's a lot of attention and a lot of hype about psychedelics, and sometimes they're discussed a bit as like this magic bullet, like you have severe psychiatric problems, you take the substance and you are somehow better, which is generally not the case. They work therapeutically because they can instigate this therapeutic process, and it can take months before you really reach a point where you have integrated it into your daily life.
Yeah, I
Yeah.
guess also that really influences because then the set and the setting is also really conducive for healing, because the setting, the mindset of the people is already pre-trained, basically, like what they should expect and how they should go into it. And when the trip happens, it's also really just about how do we get through this? How do we untangle your psychological turmoil, so to speak? And I
Yeah.
think that adds to it, because as you said, some people think it's a magic bullet, and then they try to like self-heal and forget that, okay, the setting is also really important, and you need to be mindful of all those things.
Yeah, and that's actually something that's very important that you're mentioning that, because creative use or people using it to self-heal, as you're saying, it's very different from how these substances are used currently in clinical research. So from the research that has been conducted, we know that it's relatively safe to do that kind of therapy, but there's a big difference between how it is done in research and in therapeutic context and how people would use it at home or self-administer. And basically already having 2 very experienced therapists next to you that can guide you through if you're having difficulties or if you're panicking or feeling anxiety, they can help you through it. And if you don't have that at home, that already makes a big difference. Also, the whole preparatory period before it, where you really learn about what's gonna happen, what might happen, because you never know for sure, but what might happen, how can you deal with things, what do you want to work on? That also really influences the safety of these kind of therapies. So it's good it's good to create awareness. That's a big
100%.
difference.
Can you elaborate on some of that and some of the limitations of the results?
Yeah, sure. For example, we know that a lot of studies have very small sample sizes. A lot of studies that are currently being conducted in clinical research are pilot studies, so with samples of maybe 10 to 20, maybe sometimes more, sometimes less participants. And that really isn't enough to really draw conclusions about the effectivity or the efficacy of these kind of treatments. That's one limitation. Another big limitation is that a lot of these studies are open label. So that means people will know what kind of treatment they're getting. So they know that they're getting MDMA or psilocybin or whatever. And that, like we were talking earlier already, creates to this certain expectation that people have about a treatment. So then in the end, we can't really know whether the results are because they expect those results to be the placebo effect, or whether that's really coming from the therapy and the substance. Another limitation is that if it's not open label, it might be controlled study, so which is the gold standard currently in research, that we have treatment group and a control group. But some studies have a control group, but the problem is, so usually when you tell people you might be getting a psychedelic or you might not. And then people really realize whether they actually received the psychedelic, because it has all these effects on your perception and how you're feeling. So people know whether they're in the control group or not. So that again creates this expectancy effect and biases the results in the end. Yeah, all these things together and some more limitations lead to us not knowing for sure whether the effects that we see right now are inflated or whether they're actually correct or whether they might be completely different. It points in the good direction, but we need to be careful because we have these limitations with
We need more research then.
Basically, yes, we need more
Understandable.
research, larger studies
Well,
and more.
And actually, another bias that is not always talked about is that many researchers within this field actually have some prior experience with psychedelics themselves. Oftentimes, it was a meaningful thing to them, or it really fascinated, and they decided to pursue this line of research, which doesn't have to be a problem. If you study musicology and you're a pianist, I don't see how that's a problem. But there is this kind of unspoken thing in psychedelic research that a lot of people, if not all of them, perhaps 99% of researchers have had some prior experience that also influences expectations and can increase the likelihood of, well, not data forgery necessarily, but things moving in a certain direction.
Yeah, looking at the data, a bit of a bias, from a bit of a bias standpoint.
Yeah, which is also definitely a thing to consider.
Can we talk a little bit about microdosing? So what are your opinions on that? What kind of research is going on? And what are some of the benefits, the downsides for microdosing? Because I do know that there's a lot of hype around the topic. So can we discuss it a little bit? What do you guys think?
Yeah, so first of all, I'm not an expert on the topic, so I can maybe give a bit of broad idea of what's going on currently, but yeah, know that I'm not an expert in it. But so basically there's a lot of what the idea behind microdosing is that you take a 10th or a 12th of a full dose of a substance, for example, LSD or psilocybin, so truffles or mushrooms. And the idea is that you take it every other day, so for example every third day, and you're not supposed to feel anything consciously, but unconsciously it's supposed to affect you in positive ways, ideally. So people report that they feel better, that they have a better mood, that they feel more creative, for example. The catch is that we haven't really found evidence on this in research. So there are a lot of studies that confirm these results, but then again the problem is there is usually no control group. And the few studies that have been conducted that also have a control group, so that also see how people report all these things when they're actually thinking they're getting a microdose but not getting one, they haven't really found much evidence for this. So that's a bit the problem. And then there are researchers that are saying this is because we don't really have the right measures at this moment to actually measure these effects. That could be the case, but at this moment we don't really know we don't have scientific evidence whether microdosing is actually doing all these fantastic things that people report anecdotally.
Or if it's just placebo.
Or whether it's just placebo.
Understandable.
Yeah, which is not stopping a lot of these commercial parties, of course, for really propagating the benefits of microdosing. Personally, I'm in this social media algorithm where I just get bombarded with all these different companies that sell microdosing products. So
I get the lot too.
Yeah. You might be in the same algorithm. So over the past few years, they have really sprouted all these commercial companies who really try to sell you on the benefits of microdosing for creativity, feelings of well-being, flexibility. It will make you a productive worker. It will make all your work problems easier to solve. Generally just makes you a better human being. And there seems to be a lot of overlap with kind of homeopathy products as well. This wellness commercial thing going on. It seems to be very popular with people in tech as well. I think in Silicon Valley, in the US, but in the Netherlands as well. It's definitely taken a lot of flight over the recent years. But as Annika said, the evidence is very mixed at best, but we also might not have the proper tools to measure these things. Because, for example, for microdosing and creativity, they have this measure, which is the alternative uses task. Maybe you've heard of it, which they ask you, for example, how many uses think of for a brick, for example, and then you can measure how original the answer is that you have, but also the utility of your answer, which is one way to measure it systematically. But the question is, how well does that translate into creativity musically, for example, or at work, or just in your general problem-solving skills? It might not translate well. So that could also be an issue.
Yeah. And you were speaking a little bit about how and we discussed this before our podcast in the first call, that there's a political side to the entire field of psychedelics as well. And you also mentioned that the Dutch government takes a really liberal approach to psychedelics and just drug. Maybe not psychedelics too much, but taking drugs is decriminalized and truffles are legal. So what does that mean? How do the Dutch parliament looks at the research that is going on? What are some of the steps that they might be taking to introduce more of this into the mental health care of the Netherlands? How does that look like?
Yeah, so that's a great question. Actually, most of these drugs that are being discussed here in the psychedelic space, like MDMA, psilocybin, DMT, and LSD, many of them are included in our Opium Act, which means they are forbidden. And most of them are also Schedule 1, which means the most severe category and no medical uses have been proven. At the same time, these substances are also low priority for the Dutch police. If you are found to be possessing them, you will generally not even get a fine if it's a small quantity, and it's not very high priority. To your question, to what degree the government is undertaking any steps here, actually our Minister of Health, Ernst Kuipers, in the previous year, he was outspokenly positive about psychedelic therapies and about the developments going on there. And he wasn't just aware of them, but he actually said that the Netherlands could take a leading role in the developments of the right frameworks, training, and to maximize the effectiveness of these therapies. So he's actually very
That's exciting.
much in favor of it. Yeah. But then, of course, there's a whole political reality. Just because he's in favor of it doesn't mean that actually things will end up happening in the short term. And another development that's happened is that I think it was October of last year when many of the more prominent psychedelic researchers in the Netherlands, like Michiel van Elk, Kim Kuipers, Joost Breeksema, Tijmen Bostoen, who is a colleague of Annika, and many others, they were at a roundtable discussion in Parliament where they discussed the therapeutic uses of psychedelics. And they actually had a panel at the start with patients who told of their experiences with psychedelic therapy and the severe mental health conditions that many of them have been struggling with and how they work through these therapies. And that made a big impression on the politicians that were present there, who represented all sorts of different political parties, from the conservative right to the liberal and progressive left and the political middle as well. All sorts of representatives were present. And out of that came two different motions that were filed in Parliament, one of which stated that they requested the government to remove all legislative barriers to implement the psychedelic therapies into mental health care. And the other motion requested the government to evaluate to what degree researchers and clinicians are experiencing barriers. So one of them was a bit more progressive and one of them was a bit more conservative, because just evaluating, you can write a report and then it still remains the question whether anything's going to happen. The second motion, so the one that went a little bit less, was actually approved in Parliament.
Okay, so they are evaluating the barriers of psychedelic research.
Yes, they're going to evaluate to what degree researchers and clinicians, such as Annika, are experiencing barriers in administering these substances in research settings, and also in the context of a compassionate use program, which they have in Canada, for example, and in Israel, where you can administer these substances even though they are not legally accepted for that particular medical use. For example, for end-of-life anxiety, so patients who have a terminal diagnosis, such as cancer, and have no hope of recovering from that, and suffer from the existential distress that comes with that. In some cases, in those countries I mentioned, you can administer a psychedelic such as psilocybin to help them and also their loved ones who are around them to deal with that situation.
Yes, accept that state.
Yeah.
What are some of the barriers that you are facing, if you talk about that?
Yeah, I knew you were going to ask that. That's actually something I cannot really go into
Okay, yeah.
from my
I
work.
respect that, yeah.
Yeah.
Okay. Basically, I have one last question. Like, what are some of the past researches in terms of LSD use and how it can be helpful for clinical approaches? And what are some of the specific research that is being conducted or was conducted in the Netherlands?
When we're looking at LSD specifically,
Yeah, first let's go into LSD and then maybe we can broaden it a little bit, because I know that there's many research, especially since here it's like more liberal, right? In Europe, I think the Netherlands and Germany also, I think they are the pioneers of this psychedelic research. Am I correct?
when you look at Europe, I think that would be correct, unless you consider the UK part of Europe as well, because a lot of research is being done there
And
as well.
Switzerland.
And Switzerland, of course, which is not part of the EU, but yeah, they have been doing LSD research for decades.
Okay.
And it's also a Swiss invention, LSD.
Yeah, Hoffman.
Exactly, Albert Hoffman invented that. And perhaps it's because Switzerland was never really as much constrained by European law that they actually never really stopped doing psychedelic research. Perhaps during the 90s, it was a bit less.
Yeah, but they've also continued treatment there with these substances
Yeah.
in Switzerland, which is unique. In
So the basically legal treatments in Switzerland happening.
In some cases, yeah. It's still not very widespread, but because with specifically the case of LSD, the reason it has been researched a bit less in this recent wave of psychedelic research is that the duration of LSD is quite a bit longer than many of these other substances. So with MDMA, you're looking at maybe 5 to 6 hours and still come down after. It can be similar for psilocybin. DMT in some cases only lasts about 10 to 15 minutes. But with LSD, it can be up to 12 hours or maybe even 14 hours, which complicates things and makes things very expensive if you want to embed them in a therapeutic framework. And the question is whether you really need that duration. Does it really need to be 14 hours? Perhaps it only needs to be an hour and a half or 2 hours. But one interesting development that has happened in that area is that last year they demonstrated that if you give the substance ketanserin, which is a selective serotonin 2A receptor blocker, which is the main receptor where these classic psychedelics enact their effects. If you give that substance about 1 hour after someone has taken LSD, you can shorten the duration of the trip to about 3 hours, which can make it a lot more valuable and a lot more usable in these therapeutic frameworks. But I think in some of the major studies going on, LSD is actually not the main target that people are looking at.
True. I heard a lot of things about ketamine lately. Maybe we can also go into that a little bit, especially with like depressive symptoms and long-term depression, that ketamine can be really helpful, but I don't know exactly the science or the neurology or the current research. Can you share a little bit on those aspects?
Yeah, sure. So ketamine is not directly classified as a psychedelic. More in a more broader definition of psychedelics can fall under that term. But
Yes, it is associating.
yeah, dissociative.
Dissociative anesthetic.
Yes, exactly. Correct.
And there's actually been a lot of research on ketamine. It's a substance that was already used in anesthesia before on humans. So in when people had operation, they used ketamine as well. So it's a substance that was already around, that was already used on humans, which made research with it a bit easier because it's not an unregistered substance. And the main focus of research with ketamine was on, like you're saying, depression, treatment-resistant depression. And it has shown very good effects on that, which actually led to the registration of it as well, also here in the Netherlands. So it is allowed to use it as a treatment, although there are some difficulties around it to actually use it in the end. But it is actually one of the only psychedelic, if we're using the broad definition, that is currently being given as a treatment for treatment-resistant depression or depression in general.
Yeah, and as Annika said, it's been around like since the 1960s as an anesthetic. If you're in an accident and you break a leg and the ambulance picks you up, like likely one of the first things you'll receive is ketamine. And it has a very favorable safety profile. Like it doesn't do much with your breathing or your blood pressure. So it's pretty established as a safe substance. And it still remains the question, what route of administration is the best for ketamine? Because I think at first they were using a pharmacological model where you sit in this clinical setting in a chair and you get an intravenous dose of ketamine. They leave you alone in this room, and every once in a while, a nurse comes to check your blood pressure while you're having this major experience. And in some cases, that was enough to relieve depression symptoms. But actually, recently, a study by Joost Breeksema and others at the University Medical Center in Groningen in the Netherlands did a study, a qualitative study into the subjective experiences of these people that had a lot of difficulty sometimes letting go and giving in to the experience. And I think their main conclusion was that people really need guidance through that experience as well, that it's not just a pharmacological thing going on, which also might be important, but there's still all these psychological, subjective experiences going on, and that requires a bit more attention. But there's actually a Dutch pharmaceutical company called Janssen, which developed this nasal spray called Spravato, which contains ketamine. And in some cases, people can take it at home, and that might be a more effective way to do it, also more cost effective. You can get an IV drip of ketamine, there's oral ketamine, and there's all these questions that still remain.
Which one is the most effective?
Which one is the most effective?
But also good to mention here is maybe that the idea of how it is used as a treatment is a bit different from things like MDMA or psilocybin. So what we were talking earlier, MDMA and psilocybin are currently administered usually 2 or 3 times in a psychotherapy context of a few months. And with ketamine, the idea is a bit different, that people keep using it and not on a daily basis, but every few weeks, for example. Because what we see in research is that the symptoms go down. So people feel better, but they also come back if they don't keep taking it. And that's also one of the risks that you have with ketamine, because it can be an addictive substance. So that's also where you need to be with ketamine.
The question is, for example, if somebody has severe, let's say, depression and they are using antidepressants, which one is better? Is it better to go in a hospital, take some ketamine like once a month, or is it better to be addicted to Ritalin or Xanax or something like that?
That's a
to
good
be
question.
discussed.
The two things you mentioned are not antidepressants per se, but
Okay,
but I think I read some cases where it might be an application for acute suicidality. So someone who's really, for example, at the point where they are like at this crisis situation. What tends to, I work in mental health care myself as well, is that people get a sleeping pill for one night and they're like, sleep it off and see how you're feeling the next day. But if there are really severe signals that someone might have a concrete plan to end their life and it's a crisis situation, then the application of ketamine might extend that period that someone is less suicidal. It's not going to fix their depression immediately. It's not going to fix all their problems that might have led to that depression, but it could potentially save lives in situations like that.
Yeah.
Really interesting.
And also coming back to what you're saying, what's better, being addicted, quote unquote, to antidepressants or ketamine? The thing with ketamine is also that it can create new opportunity for therapy. So people that are depressed, there's often little room to work on things and to go through therapy because the symptoms are so strong. But an idea can also be that ketamine can give a bit of a first boost, if you want to put it like that. And then that creates room to actually work the issues that you have or work on your
trauma, whatever.
Yeah.
Really interesting what the future holds, I think, for these studies. And I think we should wrap it up. What do you guys think? Do you want to say anything before we finish off?
Yeah, thanks for having us.
Awesome. I'm really glad that you guys came.
I enjoyed this and it was nice to talk about this topic.
Awesome.
Yeah, definitely. And just if anyone's listening to this who is a student, is interested in psychedelic research, I would, of course, recommend joining APRA. Our website is apra.science. And if you want to keep up to date, you can get our newsletter and you can really get a first row seat of all these developments that are going on.
Awesome. Yeah, I was about to ask that, like, where do people find you? So Instagram and also your website. I will link both of them in the show notes so they can find you and join and connect and see one of the lectures if they are in Amsterdam. So they can get the latest things that are happening in terms of psychedelics.
Yeah, and if they want to get more involved, we're also always
volunteers.
happy with more new volunteers.
Awesome.
Absolutely.
It's a great way to connect with other like-minded people and talk about the topic all day.
Thank you guys once again for coming in.
Thanks.